Bookings for 3 mass immunization clinics for Toronto residents ages 80 and up open tomorrow. There are, though, new warnings about a possible third wave in Ontario. New projections show a worst-case scenario of up to 8,000 new cases a day in the province by April, but there are more optimistic scenarios as well. Those case counts between 1,600 and 5,800 per day. Ontario's Science Advisory Table says about 42% of new daily cases in Ontario are caused by variants of concern.
We have two different pandemics. We have the well-known one that has been bothering us for a year now, which is actually continuously well under control. This works, but the new variant didn't, really get controlled through the lockdown we had in January, and continues to grow.
John Tory is Mayor of Toronto. He joins us now from that city. Hi, Mayor Tory. Good to see you. Thank you for making the time.
Pleasure, Vassy.
I have a bunch of questions for you on the vaccine rollout, but I do want to start with those warnings and with the possibility of the variant causing an even wider spread of the virus. How worried are you about that 42% number and what it might do?
Well, I've been worried all the way along. I've worried every day for the past year, and today's no exception. The numbers of the case counts of COVID-19 have stabilized, but they've stabilized at a place far higher than at the end of the summer. To give the listeners across the country an idea, they're stabilized at around 350, 375 new cases per day, whereas at the end of the summer it was about 50. But the variants of concern, of course, weren't something that were really on the radar screen at that time, and it's now constituting 40% of the cases. So it's a real concern, and it's why we've been taking a cautious approach to reopening. And I know that causes great frustration and heartache for some people, but we think it is best to be cautious and to take this one step at a time, with health being the foremost consideration, though not the only one. The psychology of the people is important. We live in a big region, 3 million out of 7 million people in the region. And also there's, of course, the very important question of business and what's going on with the impact on people and on employees and owners of businesses. So it's a very complicated situation, but health we're watching very, very carefully.
What does the information presented by the Science Table mean for the reopening in Toronto? And just again, for our viewers across the country, I mean, it's essentially been somewhat locked down right since the beginning of November. It's been one of the longest lockdowns in any part of the country. So does it delay moving, for example, into what's known as the red zone, so a zone with a little bit less restrictive measures?
Yeah, the main difference with the red zone is you'd be able to see personal service businesses open, which they're not, nails and hair and things like that. And also, of course, very importantly, restaurants and bars, which have been basically locked down in Toronto for months, as you say, and they've really suffered. I think it means we have to keep discussing this every day, because there are some things that are improving. Hospitalization rates have been improving, but there are other things that have not been improving, like the reproduction rate of the virus and some of these case count numbers that you hear about that I was just mentioning. So we're discussing it every day. I want to see us try to keep moving along a path of reopening cautiously and gradually, but keep moving. But we have to do it within the context of those factors that I mentioned, and they're all relevant, but none more relevant than obviously the state of the virus itself and what it's doing in terms of its spread.
I'm just trying to read between the lines there. Or when might a decision be made? Just for people, I just asking on behalf of people watching who are wondering, hey, will I be able to open my hair salon? When might they know? And ultimately, how will you make that determination?
Well, the provincial government makes the determination on advice received from us, and I will just say to you that we are assessing it every day. I've been, I have not stated a time frame within which I think this should happen, except to say as soon as possible. And so, we're going to be engaged in very, very deliberate discussions on this and all the details, because it isn't about any one number, and it's about those other factors I mentioned: psychology of the people, business, the regional circumstances, where other municipalities in the area around Toronto are in a more liberal state of affairs at the moment. So that is a factor as well. So we'll just have to keep discussing it every day and do in the end what is right. I have long since passed in this pandemic, and even before that, the notion that you should worry about what's popular. You just have to try and do what's right. It's a struggle when it comes to a whole year of this and to numbers that go up and down and variants that arise and new things that happen. But thank God we've got the vaccines, and that does offer, a real degree of hope for people that while I can't say today happy days are here again and we should sort of fling open the doors, but I can say that the vaccines offer great hope.
Yeah, and I'm certainly not saying, do what's popular. I'm just asking from the perspective of people who are interested in a timeline. My guess is they'll know something, whether it changes or stays, by Friday, right? That's normally when the province...
I think probably in the case of Toronto, next Friday, because we've only been a week in this new gray state, and the gray state allows some retailers, in fact, thousands of stores have been opened this week for the first time in months, smaller retailers and so on, and not the businesses I mentioned, restaurants and personal service businesses. So thousands of businesses have opened with capacity restrictions just this week. And so I don't think there'll be any decision affecting Toronto's status differently tomorrow, but I think it will come after that.
Okay, let's talk a little bit about the vaccines. People over 80 will be able to book appointments starting tomorrow for 3 mass immunization clinics that will open next week. How confident are you in the booking system? And I ask because I've seen evidence right across the country of some major hiccups, especially in the initial hours and days. Is it going to work, do you think?
I ran a big company which had new systems and new products were being launched all the time, and I never saw one that was absolutely flawless at launch. But having said that, we've tested this system, we've looked at it, it's user-friendly. It doesn't require people, seniors or others, to come up with a huge amount of information. So, fingers crossed. That's all you can do. And we're optimistic, but you got to have your fingers crossed. And this will allow tomorrow, as of tomorrow, 133,000 booking appointments between the 17th of March and the 11th of April to be opened up to people 80 years old and older, only those people, nobody else. And I think that's going to be a big opportunity for us. And we've got the clinics ready to go. In fact, they've been ready to go for several weeks. All the furniture's in. If you looked inside, you'd think, well, why is this place not operating? Well, we just didn't have the supply. But now we will, and we'll be able to proceed with those 133,000 appointments tomorrow. And I think the system will hopefully work fine.
Could the system have been opened up prior to the supply coming in? I asked because I remember about 2 weeks ago interviewing a public health officer in Guelph. They were already booking people for over 80 for appointments. Could Toronto have been doing this earlier?
Well, yes, but of course you have to ask yourself the point. Would it make people feel better for a few days to have made their appointment, say 5 days earlier, but they still can't go until there's a supply of vaccine? I mean, the one gating factor that, of course, is more important than any other is the supply of vaccine. And we're opening these clinics at the beginning of next week, but we will get the vaccine the day before. And so, that's the reality of this. We couldn't inject vaccine into people's arms. Now, we have done through hospitals and other clinics. Like we had 27 clinics open in Toronto today, and we have done so far 217,000 vaccinations. So it's not like we've not been doing anything, but these mass immunization clinics needed supply. They couldn't open until we had the supply, and we had the supply confirmed to us last week, announced we're opening the clinics as soon as the supply actually is in our hands, which is early next week.
And if the supply is certain going forward, is there any kind of assessment being done at the city as to what we've heard on a more provincial and federal basis as to how soon everyone in the city of Toronto who wants a first shot of that vaccine might be able to access one?
Well, I think the faster the supply comes, we will be able to perhaps accelerate the timetables to some extent. We're in a position to open 9 of these mass immunization clinics. And again, they're furnished and the staff has been hired and they're ready to go. And so the supply is supposed to really ramp up for Toronto and I think around the country, in the next couple of weeks before the end of this month. And so we're ready to deal with that. We've always had the capacity. It was the supply we were missing and the booking system. The booking system will open up tomorrow, fingers crossed, with 133,000 appointments ready to go for people over 80. And so I think if we were to talk in 2 weeks' time, you'd find that, a lot has occurred. And that's thanks to a 3-government effort. We really have been working hard to try to, we know people are anxious, but the notion that they could have booked their appointment sooner, sure, that might have provided a few minutes of reassurance. But in the end, I think the only time people really feel better is when they've had that needle put in their arm and they know they've actually had the vaccination. Okay,
Mayor Tory, I'll leave it there. I'm out of time. Thanks so much for your time. As always, appreciate it.
Thank you, Vassy. Thanks very much.
John Tory is the mayor of Toronto. Hi, I'm Vassy Kapelos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.